Hi, I'm Dr. Shea from Aligned Life Chiropractic and Wellness, and today I want to go over how to get the most out of your home traction orthotic so that you get the best results the fastest. So keep in mind, guys, the idea of a home traction orthotic is very similar to when an orthodontist would recommend the use of a retainer after they've taken off the braces from your teeth. So if the braces are designed to straighten out the alignment of your teeth, once those come off, the retainer's job is then to go in and ensure that the alignment continues. So we use a home traction orthotic like this in a very similar fashion to be able to help us maintain the alignment of your spine. So with that in mind, let's talk about how we get the best results. So first things first, ideally when you begin using a home traction device, whether you've taken a little bit of a break and you're getting back into this habit, or maybe you're beginning this spinal alignment project for the first time, you're going to want to use this on a very hard surface. So, not on your couch, not on your bed. These are too soft. If you've got wood floors or you've got carpet or you've got concrete or tile, these are all great places. You can lay down a yoga mat on top of those hard surfaces, place your home traction device on top of it, and then go ahead and lay down on that. That's going to give us the most benefit for this. Remember, we're really working on the passive structures in your spine. That means the ligaments and the discs. So we want this to be a very relaxed exercise. If you're in there and your muscular contraction is going really, really strong, we're really not accessing the tissues that we want to be able to stretch to allow for those new spinal positions to take place. So this is a relaxed exercise. We're doing it on a hard surface, and ideally we're doing it right after some form of exercise. Now in my practice, we recommend that you do postural-based exercises. We call these mirror image exercises. We want you to be warming up the tissues of your body to allow for the increase in flexibility. There's a number of research studies that look at how hot the tissues are around your spine actually encourages more flexibility changes when using your home traction device right after. So do your mirror image exercises, find a hard surface, lay down your yoga mat, go ahead and grab your block. And then I would also recommend trying to grab maybe a set of earphones or your phone or a book or something to keep your mind occupied while you're using this device. You're going to be using these from anywhere between 3 minutes all the way up to 20 minutes. And this is going to allow for what we call ligamentous creep, which is kind of a silly term, but that's really what it's called about in physics. So creep means stretching of the tissues as we allow time and load to be placed upon them. So we want to see that these tissues stretch into the new spinal alignment that we're looking for. The use of a home traction orthotic is not a one-size-fits-all scenario. Remember, some of you will be doing a home traction device in your neck, some in the middle back, and some even in the lower back. So keep in mind, please do not just purchase one of these off of an online resource, throw it into a certain area of your body. There's a lot of thought that goes into each of these. They're based upon your x-rays and your postural photos and so forth. So just keep that in mind as we go along here, guys. So when we use a home traction orthotic, one of the things I want you to think about is frequency. So there is no upper limit on the use of your home traction orthotic, which means you can do this as often as you would like and what your body can tolerate. So the more that you do it, the faster your results, the more complete that you will get. We have patients that do this 2 to 3, 4 times a day, and they're really trying to accumulate as many reps as possible. This is for your best results the fastest. Now, common symptoms associated with using a home traction orthotic are some soreness, maybe a little bit of a headache, sometimes some numbness and tingling going down an extremity, especially when we begin and we're ramping up time, or when we get into those higher time frames. 15, 20 minutes on these is going to be a bit of a challenge, especially in the beginning. So if you have some of these symptoms, that's very, very common. If they persist, meaning if they last longer than a few days, then obviously please come and let our staff know. That way we can make sure that we give you the right recommendation. We'll typically also review where your placement is, because that's going to be very key in regards to your home traction position. So keep those things in mind. Let's talk now about how we get this into our routines. So my best recommendation is to do what we call a habit stack. That means take a new habit, like using your home traction device, and stack it right on top of a habit that you already have mastered. So for instance, if brushing your teeth at a certain time every day takes place with great regularity, then what we want to do is we want to put the home traction device usage immediately following that. So for example, it would be like, after brushing my teeth, I will use my home traction orthotic. This way, you're not trying to build a new piece into your life. It's just a way that you can inject this into your environment and make it so that it's highly successful very quickly. One other thing I wanted to cover with you guys is one thing that I absolutely love about home traction orthotics is your ability to use these on vacation. So many times we have patients that either travel for work or they have a long family vacation and they're worried about their spinal health while they're on these trips. So what we encourage you to do is, these are all very packable. So you can take them, go ahead and put them in your carry-on or in your luggage, bring them with you to your trip, use your device, and then that way you're keeping your spinal health as a part of your vacation. So that way you don't have to worry about, things hurting or regression, etc. So use these devices, help them to make you very successful in this experience. And even after you're done with the corrective process, this will be one of the most effective ways for you to be able to maintain your spinal correction that you've worked so hard to achieve. So if you have any questions, please come and ask us in the office. We'll make sure that we go over this with you in detail. Repetition, especially with a lot of this information, is going to be key. I would also recommend inside this box, you'll find that there is a one-page informational instruction manual. The manual has on the back of it a guide that goes through the first, I think it's 20 or 40 days of usage, where you can actually mark in the amount of time you're using and the date. So progressively increase your time on these devices up to 20 minutes. If you get to a point where you're too symptomatic or it feels too uncomfortable, then what we'd want you to do is either stop at the same time frame. So if you did 10 minutes, do 10 minutes again the next day, or even for a few days. And it's okay to plateau for a little while before you can then go up to the next minute increment. So use these suggestions, and we look forward to seeing you guys at Align Life Chiropractic and Wellness.